All right, today we're going to dive into how menopause is a full body experience and how the decline in hormones like estrogen impacts our body. Also, how the role of cortisol is influenced in the menopause transition, and whether hormonal testing is actually useful or beneficial during this phase, as things like Dutch tests are becoming quite prevalent. So, let's go ahead and get started. So, to begin with, when it comes to estrogen and menopause, estrogen gets a lot of talk and attention, which it should, and for good reason. It's a big hormone and a big component of the menopausal transition. And as a reminder, menopause is officially diagnosed after 12 consecutive months without a period, but symptoms of menopause can start earlier, 5 to 10 years in the perimenopausal phase. And during this transition, the hormone estrogen begins to decline. And even though this graph shows this slow decline over time, as we already know, if we looked on a 24-hour basis, that hormone can fluctuate up and down rapidly as we are in that perimenopausal transition. And eventually it will flatline over time once we hit postmenopause. So to continue on with, it's not just estrogen that's at play here. There's multiple hormones, but another hormone I do want to talk about is FSH. And FSH is follicular stimulating hormone. That is its full name from the acronym. And FSH and estrogen are closely linked, and understanding their relationship will help explain many of the intense symptoms that women experience during menopause. And we're going to look at that shortly. So let's go a little bit deeper. What is FSH and why does it matter? So when it comes to the menstrual cycle, it doesn't just involve the ovaries. I really want to highlight to you ladies that it starts within our brain. And that's why some of these vasomotor symptoms like hot flushes and night sweats occur, which is actually stimulated through the brain. So to go ahead and break it down, in our brain, there are two little areas called the pituitary gland and the hypothalamus, and they regulate our cycle, releasing FSH. As the name says, follicular stimulating hormone, it goes down and travels to our ovaries to stimulate the maturation and release of an egg for ovulation. And as we may know, women are born with a finite number of eggs. And as we enter into perimenopause, both the quantity and quality of those eggs are on decline. And as a result, the brain increases FSH production to help stimulate ovulation and stimulate these eggs and ovaries. And essentially, what the brain is doing is it's sending a signal saying, come on, ovaries, it's that time of month, let's get an egg out. And the ovaries are responding, hey, didn't you get my message? We're running low. Why are you continually sending this hormone and trying to stimulate ovulation when there's not a lot of eggs in supply? And the reality is, it's not just a off switch. It takes a number of years for the brain to adjust to this declining egg supply. And that's why FSH levels spike early in perimenopause and eventually flatline like estrogen in postmenopause. But this communication backward forward telephone contributes to a lot of the intense symptoms we may experience during the menopause perimenopausal phase. But I want to highlight that estrogen doesn't just affect our reproductive system. As we kind of mentioned, it does affect the brain, but estrogen has receptors throughout the entire body. So as estrogen declines, every single bodily system feels its impact. And I want to share with you, here are some of the key areas that can be affected as we go through peri and menopause and postmenopause. So number one, our hair can become drier, thin, and more brittle. We have estrogen receptors in our hair. Our mouth has estrogen receptors, and it can affect our gums, our teeth, leading to bleeding gum issues or increased food sensitivities. Our skin can become more drier because we have estrogen receptors in our skin. Our skin can become itchy. We can even develop a burning sensation on our skin as well. Our bone health, we experience a increase in inflammation during this time, as estrogen is an anti-inflammatory hormone. So issues like joint pain and back pain can occur. When it comes to our metabolism, we can experience changes in fat distribution, not because our metabolism decreases, but we have our hormones affecting it, as well as we become more sensitive to insulin resistance. When it comes to hormonal regulation, it can impact our serotonin levels, our melatonin levels, our cortisol production. When it comes to our brain, estrogen dropping can contribute to headaches and hot flushes. Our breasts can change the shape, the tenderness, the swelling. Having a loss of collagen can make them droop. Heart health, we can have an increased risk of cardiovascular disease. And just as a interesting statistic, but a sad statistic, I would love to be a part of that change, is 1 in 4 women develop cardiovascular disease during their lifetime. And it is the number 1 killer of women in most first world countries like the United States and Australia. Pelvic floor and vagina health changes. We have changes in bladder functions. We have a dry vagina, pain during penetration, as well as we can have a decrease in libido, recurring UTIs. The list goes on. So as you can see, menopause is a full body experience and no organ is left untouched. And kind of talking a little bit more about different hormones and other hormones other than estrogen that is impacted during menopause, we can look at things like serotonin. So when it comes to estrogen, it actually helps produce some of these key hormones. So we can have a dysregulation in serotonin and our moods can fluctuate. We get mood swings, we can get sad, we can get depressed. These are things that can happen during peri and postmenopause. Estrogen plays a role in creating testosterone, which helps create muscle maintenance and libido. Moving into hormones like melatonin, it can affect our sleep cycle and regulation. Cortisol is a stress responding hormone. It can affect that and increase it during this time. And when it comes to insulin, blood sugar regulation, which is a key component into regulating our weight, can fluctuate during this time. And unfortunately, when estrogen declines, these hormones can shift, leading into things like overall, the hormones can shift, leading to things like mood swings, facial hair growth, sleep disturbances, increased stress, and overall weight gain. So, and the last one is looking at ghrelin and leptin. So these are 2 hormones that play around with our hunger and satiation cues, and they can be disrupted, affecting things like weight gain as well. But how about cortisol? So I'm going to share with you some truth about cortisol because I feel like that's a huge buzzword when it comes to social media, and it gets a lot of hype and attention. And I think cortisol is completely demonized as our enemy. And there is some truth in that cortisol can have some negative impacts on us, but the underlying aspect is that we actually need cortisol. It helps regulate things like our blood pressure, our cholesterol, metabolism. Estrogen is an anti-inflammatory hormone, and the reality is as estrogen declines, cortisol levels can naturally rise, and that is normal. However, if we compact that with lifestyle factors that can increase our cortisol, like chronic stress, poor nutrition, lack of movement, this can exacerbate cortisol levels, peaking them into a higher range, and it can affect different bodily processes and affect things like our sleep, our mood, and affect things like weight gain. So making sure that we have good habits underneath our belts and avoiding possibly past habits that may have worked for us when we were in our 30s and 20s that no longer work for us because our body isn't able to handle it, we need to put to the side. So things like having wine late at night with friends now can lead to things like sleep disturbances, inflammation, fatigue, and mood swings. So overall, when it comes to cortisol, it's not completely evil. We do need it. However, if we have poor lifestyle factors, it can increase our cortisol levels to a level that our body cannot handle, and it can trickle down into affecting our overall health. But moving on into hormone testing, what about hormone testing? Should we even look at things like Dutch tests? I get asked this question quite a lot, especially when it comes to Dutch testing and blood work. And the reality is, hormone testing, again, is not recommended for diagnosing menopause according to the Australasian Menopause Society. The big factor with determining if you're in menopause or dealing with menopause is simply looking at the symptoms and treating with symptom management. However, hormonal levels, as a reminder, fluctuate daily. So if we take a Dutch test or if we get a blood panel with all our hormones in it, those hormone levels can say that we're in perfectly normal markers, and that can lead to misdiagnosis or mistreatment. So we really shouldn't be looking at these as a source of treatment for our menopause symptoms. And it's really only multiple years or like 4 years post menopause where these hormone tests can actually or might be beneficial. As I've mentioned, though, blood testing still is valuable when it comes to checking nutrient deficiencies, electrolyte balances, cardiovascular health markers, all of which can impact the severity of our menopause symptoms. And that's what we do through the Through Menopause course. So, just as a final thought, I really want to highlight again, menopause is a full body transition, not just a reproductive shift. And understanding that hormonal changes plays a huge part in regards to our menopausal symptoms and the severity of them, and making sure that we make informed decisions about our lifestyle, about our health during this time can really help with symptom management.